Hi guys, it's Luke here from Podiatry. How are you? Last time, or late last year, when we had a live, I had a runner in who had a sprained ankle, and we'd done some structural tape with the good old-fashioned brown sports tape. Today we've got another runner in here today, and she's got some Achilles tendon issues. And I want to introduce a treatment modality which is becoming a nice adjunct to use, is something called Kinesio tape. Let me just explain to you a little bit about the difference between Kinesio tape and brown sports tape. Kinesio tape is not structural tape. It was originally designed for patients who suffered from lymphedema. So in layman's terms, that's trouble getting the fluid out of the tissues. So what the Kinesio tape was used, it was put around limbs horizontally, and it was found to reduce swelling and give a little bit of pain relief. And we kind of thought from here, hang on a second, if we can do this with patients with lymphedema, why can't we use this on sporting injuries? So this is a little bit of a crossover, and this is where we've got this tape. And what the theory behind the tape is, the tape will lift the muscle up a little bit to let that lymphatic system drain a little bit easier, and it will also provide a little bit of analgesia. As you can see, I've already pre-cut a bit of this tape here. Okay, this tape can last on the, obviously make sure the patient doesn't have any allergies to tapes, and this patient doesn't. But as you can see, I've cornered or cut the corners into a curve. We can have this tape on for 3 to 5 days. However, when our patient's putting socks on, or when our patient's getting into bed, we don't want this tape to be fraying or starting to lose its integrity. So that's just one of the tips that we will use to get a good application. The other application tip that I'm going to give you before we start to put it on is, please, the adhesion on it, the glue will not work that well if we touch it with the oils on our hands, okay? So as you can see, I've just bent that there and torn it from the back, okay? Now, I'm going to apply this tape here. But as you can see, I've got just a little bit over an inch here, and what we use that for is an anchor, okay? So I have just pulled that off, okay, and I'm going to put this anchor on here, but I'm not going to give this anchor any stretch at all. But as you can see, with the Kinesio tape, it's going to work better on the stretch, when it's on stretch. And as you can see here, I am stretching. When I'm pushing this in for the patient, what I want to do is I want to get this patient's Achilles into a lengthened position. So that's what I'm doing here. But as I'm applying this tape and I've put it onto stretch here, it's heat activated. So I'm going to rub this tape in nicely, like this. Okay. And I'm going to come up here, and I'm actually, so our Achilles on this patient is going to finish here. I've given a little bit of extra tape here. That doesn't matter at all. As we're coming to the end, I'm going to lessen the stretch, okay? And this patient's told me, and I know that we're getting a little bit of medial pain up here. If we were getting a little bit of lateral pain, I would just follow this tape up on the course of the outside of the calf muscle there. But as you can see, as we're coming towards the end here of this tape, I haven't put any stretch on that at all. Okay, so as you can see there, guys, just got an application of Kinesio tape. So what have I used this for? I've used this for my patient who's getting into a bit of running. We've got some Achilles tendinopathy here, a little bit of pain. This Kinesio tape's not only limited to Achilles issues. If we have other muscular issues, you will see football players, cyclists, you will see netball players, who will all have this fancy coloured tape on their legs. Not all of them, but if they have muscle injuries, it's quite popular. You can get this at the chemist. The main brand that people have is Rock Tape. As I said, you can have it on for 3 to 5 days. If you have any questions at all, guys, as always, please comment underneath. We will get back to you on how this patient is going. But if you do have any questions or any other comments, as I said, please comment underneath. And thank you for watching today.